Recent years, the number of women of reproductive age who are classified as obese has risen dramatically. Obesity, defined as a body mass index, BMI of 30 kg/m2 or higher, is now a significant public health concern, especially during pregnancy. This trend is not limited to high-income countries. It is increasingly seen in middle and low-resource settings as well. The implications of this rise are profound, affecting not only the health of mothers but also their bodies. As we begin our exploration, it's important to understand just how widespread maternal obesity has become, and why it demands urgent attention from public health professionals and society as a whole. Obesity rates among women of childbearing age have surged globally. For example, in England, the prevalence of obesity among women aged 15–44 increased from 12% in 1993 to 18% in 2006. In the United States, nearly one-third of women aged 20–39 were obese by 2010. This means more women are entering pregnancy already obese, which has direct consequences for both maternal and child health. The global nature of this epidemic highlights the need for coordinated action and awareness, as the health risks associated with maternal obesity do not respect borders or socioeconomic status. Maternal obesity is defined as having a BMI of 30 kg/m2 or higher during pregnancy. This threshold is important because it marks a significant increase in health risks for both mother and baby. The BMI is a simple calculation using height and weight, but it has become a crucial tool in identifying women at risk. Understanding this definition helps health professionals and expectant mothers recognize when additional care and support may be needed. As we move forward, keep in mind that maternal obesity is not just about numbers, it's about real health outcomes. While the general public is increasingly aware of the dangers of obesity, the specific risks associated with maternal obesity are less well known. Maternal obesity is now recognized as a new and emerging threat to public health. It not only increases the risk of chronic diseases like type 2 diabetes, but also leads to a host of complications during pregnancy, labor, and after birth. The growing prevalence of maternal obesity means that more families and communities are affected, putting additional strain on healthcare systems and resources. Obese women face a higher risk of complications during pregnancy and childbirth. These include miscarriage, gestational diabetes, hypertensive disorders like preeclampsia and thromboembolism. The risk of needing instrumental or cesarean delivery is also increased. After birth, obese mothers are more likely to experience postpartum hemorrhage, infection, and longer hospital stays. These complications not only impact the mother's health, but can also affect the baby's well-being, making maternal obesity a critical issue for both individuals and healthcare providers. Studies have shown a clear link between maternal obesity and increased risk of death during or after pregnancy. In the UK, 27% of women who died during pregnancy were obese. Conditions such as thromboembolism and cardiac disease are more common among overweight and obese women. These statistics underscore the seriousness of maternal obesity and the urgent need for effective prevention and management strategies. Addressing maternal obesity could save lives and improve outcomes for countless families. Maternal obesity doesn't just affect the mother, it also poses significant risks to the fetus. One of the most concerning outcomes is an increased risk of stillbirth. Overweight and obesity are among the most important modifiable factors in reducing late gestation stillbirths in high-resource countries. Babies born to obese mothers are also more likely to be large for gestational age, which can lead to delivery complications and long-term health issues. These findings highlight the importance of addressing maternal obesity for the health of the next generation. The concept of fetal programming suggests that the environment in the womb can influence a child's health later in life. Suboptimal nutrition or overnutrition during pregnancy can increase the risk of obesity and chronic diseases in adulthood. This idea, first proposed in the 1980s, has gained strong support from both human and animal studies. It means that what happens during pregnancy doesn't just affect the baby at birth, it can shape their health for years to come. This understanding makes supporting healthy pregnancies even more critical. Children born to obese mothers are more likely to become overweight or obese themselves, not just in childhood, but also as adults. This increased risk is influenced by both genetic and environmental factors. Studies have shown that children born after their mothers underwent weight loss surgery were much less likely to develop severe obesity than their siblings born before the surgery. This suggests that maternal health and nutrition before and during pregnancy play a powerful role in shaping a child's future health. Developmental plasticity refers to the ability of the fetus to adapt its metabolism and physiology in response to environmental conditions in the womb. This adaptation can protect vital organs, but may also increase the risk of metabolic disorders if there is a mismatch between prenatal and postnatal environments. For example, if a fetus adapts to a low-nutrient environment but is born into a world with abundant food, this can lead to obesity and related health problems. Understanding this concept helps explain why maternal nutrition is so important. Research in animal models has provided valuable insights into how maternal nutrition affects offspring. For example, rats exposed to nutrient restriction in utero and then given a rich diet after birth develop more body fat and abnormal metabolism as adults. Conversely, maternal overnutrition and high-fat diets during pregnancy have been linked to high birth weight and increased risk of obesity in offspring. These findings reinforce the importance of balanced nutrition during pregnancy for both immediate and long-term health. Maternal obesity is associated with changes in placental function, including inflammation and altered nutrient transport. These changes can contribute to high birth weight and abnormal metabolic profiles in babies. Some studies suggest that placental inflammation may even restrict nutrient transfer, leading to a mismatch between prenatal and postnatal environments. This complex interplay between maternal health, placental function, and fetal development highlights the need for more research to fully understand these mechanisms. There is strong evidence that excessive maternal weight gain during pregnancy increases the risk of childhood obesity. A large U.S. study found that maternal weight gain predicted a child's BMI at age 12 and their likelihood of being overweight or obese. This relationship held even when accounting for genetic and environmental factors. These findings suggest that managing weight gain during pregnancy could help reduce rates of childhood obesity, but more research is needed to define optimal weight gain for different women. Maternal obesity presents a significant and growing challenge for public health. The risks extend beyond pregnancy, affecting both mothers and their children for years to come. Addressing this issue requires a better understanding of the underlying mechanisms, improved guidance for health professionals, and effective interventions. As we look at the challenges ahead, it's clear that a multifaceted approach is needed to support healthy pregnancies and healthier future generations. One of the main challenges in managing maternal obesity is the lack of consensus on routine weighing during pregnancy. While some countries have guidelines for gestational weight gain, others do not. In the UK, for example, there is no clear evidence-based guidance on weight management in pregnancy, and routine weighing practices vary widely. This lack of standardization can lead to confusion among health professionals and pregnant women, making it harder to provide consistent advice and support. Excessive weight gain during pregnancy is associated with increased risks for both mother and baby. High weight gain can lead to gestational diabetes, hypertensive disorders, and complications during labor and delivery. It can also increase the risk of postpartum weight retention and future obesity. Monitoring weight gain and providing appropriate advice is essential, but health professionals often lack clear guidance on what constitutes excessive weight gain, especially for obese women. Many health professionals, including midwives and obstetricians, report limited knowledge about pregnancy weight management. This lack of expertise can make it difficult to provide effective advice and support to pregnant women, particularly those who are obese. Inconsistent and sometimes unsafe advice has been reported, highlighting the need for better training and collaboration among healthcare providers. Ensuring that all professionals have the knowledge and confidence to discuss weight management is a key step in improving care. Pregnant women, especially those who are obese, often report receiving inconsistent or unclear advice about weight management. Some women feel anxious about being weighed, while others want more information and support. Many express a desire for advice that is sensitive and tailored to their individual needs. Understanding women's perspectives is crucial for designing effective interventions and ensuring that care is both respectful and effective. Routine weighing of pregnant women began in the 1940s as a way to assess maternal nutrition and detect complications. However, by the 1990s, this practice was largely abandoned in some countries due to debates over its usefulness. Today, practices vary widely, with some services still weighing women regularly and others only at the initial appointment. The obesity epidemic has renewed interest in routine weighing, but there is still debate about its value and how it should be implemented. Today, antenatal weighing practices vary not only between countries, but also between different maternity services within the same country. In the UK, for example, some women are weighed only at their first appointment, while others may be weighed more frequently. The main reasons for weighing now include calculating medication dosages and planning for special equipment if needed. However, the lack of standard practice can lead to gaps in care and missed opportunities for early intervention. Accurate recording of BMI at the first antenatal appointment is crucial for identifying women at risk and providing appropriate care. However, studies have found that BMI is often not recorded or is based on self-reported height and weight, which can lead to underestimation. Objective measurements are essential to ensure that women receive the support they need. Early identification allows for timely advice on nutrition, exercise, and screening for complications like gestational diabetes. Monitoring weight gain throughout pregnancy can help identify women who are at risk of complications. However, the lack of clear guidelines means that many women are not monitored after their initial appointment. This can result in missed opportunities to provide advice and support, especially for those who gain excessive weight later in pregnancy. Reconsidering the role of regular weighing could help improve outcomes for both mothers and babies. Assessing weight during pregnancy is not always straightforward. Factors such as the timing of the assessment, clothing, presence of swelling, and the type of scales used can all affect the results. These practical challenges highlight the importance of standardized procedures and the need for health professionals to be well trained in accurate measurement techniques. Reliable data is essential for effective care and for tracking trends in maternal obesity. Many pregnant women report a lack of advice and support regarding weight management. Health professionals may feel uncomfortable discussing obesity or unsure about what advice to give. This can leave women feeling unsupported and confused about how to manage their weight during pregnancy. Addressing these gaps requires better training for health professionals and more resources to support women in making healthy choices. Dietitians play a key role in supporting pregnant women, especially those who are obese. However, even dietitians sometimes question the value of their input, particularly when referrals are made without clear guidelines or objectives. Collaboration between midwives, obstetricians, and dietitians is essential to provide comprehensive care. By working together, health professionals can ensure that women receive consistent, evidence-based advice on nutrition and weight management. Research shows that obese pregnant women often feel that the advice they receive is inconsistent and sometimes even unsafe. Some health professionals have recommended weight loss during pregnancy, despite a lack of evidence supporting its safety. Women have also reported feeling anxious or judged during discussions about weight. These experiences highlight the need for sensitive, individualized care and clear, evidence-based guidelines for health professionals. The way health professionals discuss weight with pregnant women can have a big impact on how the information is received. Some women prefer direct language, while others may find certain terms upsetting. Building rapport and using sensitive, respectful language is key to effective communication. Health professionals need training to navigate these conversations and to provide support that meets each woman's unique needs. Some studies suggest that self-weighing, when combined with lifestyle interventions, can help limit gestational and postnatal weight gain. However, more research is needed to determine the best ways to use self-weighing as a tool for weight management during pregnancy. Encouraging women to take an active role in monitoring their health can be empowering, but it must be supported by appropriate guidance and resources. There is ongoing debate about the best antenatal interventions for women with a BMI of 30 or higher. While guidelines recommend early advice on weight management, there is little agreement on what specific interventions work best. Successful programs often include behavior change techniques, such as feedback and weight monitoring. More research, including randomized controlled trials and long-term follow-ups, is needed to identify the most effective strategies. Pregnancy is often described as a teachable moment, a time when women are especially motivated to make healthy changes for themselves and their bodies. This presents an ideal opportunity for health professionals to provide advice and support on weight management. Interventions during this period can have both short and long-term benefits, not only for the mother, but also for her family and future children. Dietary interventions are a crucial component of successful weight management programs for pregnant women. Studies suggest that focusing on the positive outcomes for both mother and baby can increase the effectiveness of these interventions. However, the quality of research varies, and more high-quality studies are needed. Including women's perspectives in the design of interventions can help ensure that their needs and preferences are addressed. The use of technology, such as apps and social media, is emerging as a promising way to support antenatal lifestyle interventions. Technology can help deliver information, monitor progress, and connect women with support networks. While early research is encouraging, more studies are needed to determine the best ways to use technology to support healthy pregnancies, especially for women with higher BMIs. Obesity prevalence varies by ethnic background, adding another layer of complexity to maternal care. For example, women of Black African, Caribbean, and Pakistani backgrounds tend to have higher rates of obesity. South Asian groups are at increased risk of type 2 diabetes and cardiovascular disease. Recognizing these differences is essential for providing culturally sensitive care and for identifying women who may need additional support. Cultural beliefs about body size and food can influence attitudes toward weight and nutrition during pregnancy. In some cultures, being overweight is seen as desirable, while in others, certain foods are preferred or avoided. Extended families may encourage eating more, and new immigrants may face challenges in adapting to different food environments. Understanding these beliefs is crucial for health professionals to provide advice that is both respectful and effective. New immigrants often adopt the dietary habits of their host country, which can lead to increased consumption of processed foods high in fat and sugar. This dietary acculturation can contribute to weight gain and increased risk of obesity. Health professionals need to be aware of these challenges and provide practical support, such as help with reading food labels and cooking on a budget, to help women make healthier choices. Social isolation, lack of a support network, and limited access to safe places for exercise can all contribute to weight gain among new immigrants. These factors can also lead to feelings of depression and stress, which may further impact health. Addressing these social and environmental challenges is an important part of supporting healthy pregnancies, particularly for women from minority or immigrant backgrounds. Vitamin D deficiency is more common among obese women and those from cultures where skin is covered for religious or cultural reasons. Limited sun exposure reduces natural vitamin D synthesis, increasing the risk of deficiency. Health professionals should recommend vitamin D supplementation for at-risk women to support healthy pregnancies and reduce complications related to deficiency. Health professionals must tailor their advice to reflect the cultural beliefs, food preferences, and practical realities of the women they care for. This includes providing information about culturally specific foods, cooking skills, and the challenges of living in a new environment. By understanding and respecting cultural differences, professionals can offer support that is both acceptable and effective, helping to minimize health complications related to obesity. Provide effective care. Health professionals need training that includes dietary and nutritional information, as well as cultural competence. This training should help them feel confident in discussing weight management and in providing advice that is tailored to each woman's needs and background. Ongoing education and support for health professionals are essential for improving outcomes for obese pregnant women. Support from family and community can make a big difference in helping pregnant women manage their weight. Encouraging healthy eating and physical activity within families and communities creates a supportive environment for positive change. Health professionals can work with community organizations to provide resources and programs that promote healthy pregnancies for all women, regardless of background. There's a clear need for more research to understand the mechanisms by which maternal obesity affects pregnancy and offspring health. Studies should also examine the effectiveness of routine weighing, the best interventions for weight management, and the impact of psychosocial and cultural factors. High-quality research will help develop evidence-based guidelines and improve care for all pregnant women. To address maternal obesity, several recommendations have been made. Improve understanding of how obesity impacts pregnancy, increase research on routine weighing, enhance training for health professionals, include diet and physical activity in interventions, and understand psychosocial and cultural influences. Implementing these recommendations will require collaboration among healthcare providers, researchers, and communities. Supporting healthy pregnancies for women with obesity involves a combination of early identification, tailored advice, and ongoing support. Health professionals should work closely with women to set realistic goals, provide practical resources, and address any barriers to healthy living. By focusing on both the physical and emotional aspects of care, we can help women achieve better outcomes for themselves and their bodies. Looking ahead, the fight against maternal obesity will require innovative solutions, ongoing research, and a commitment to equity in healthcare. Embracing new technologies, fostering cultural competence, and building strong support networks will be essential. By working together, we can create a future where all women have the resources and support they need for healthy pregnancies and healthy families. Maternal obesity is a complex and growing public health issue with far-reaching consequences for mothers, bodies, and society. Addressing it requires a comprehensive approach that includes research, education, tailored interventions, and cultural sensitivity. By raising awareness and implementing evidence-based strategies, we can help ensure healthier pregnancies and brighter futures for the next generation.